Let us now discuss checking for gynecological and sexually transmitted infections. Gynecological and sexually transmitted infections can be diagnosed by various tests. Before any tests are done, you will be asked about your gynecological and sexual history and symptoms, such as abnormal vaginal discharge, itching, soreness, abdominal pain, or whether you are feeling unwell. What to expect? There are three main types of tests to check for infection: a blood test, a urine test, and a vaginal swab. A swab is one of the most common tests you may have. The swab is a thin plastic stick with a cotton tip. It is gently wiped across the area where there may be infection or discharge. In order to see the area inside the vagina, your doctor will use a small plastic or metal viewing instrument called a speculum. The end is coated with lubricating gel, then gently inserted into the vagina, and the swab will be taken. However, you may be given a swab at the clinic so that you can take the sample yourself. Sometimes swabs are taken from sore places on the outside genital area and occasionally from the anus. What the results mean: any blood, urine, or swab samples are usually sent for testing in a laboratory. If the tests indicate that you have an infection, your doctor will recommend specific treatment appropriate for the infection, such as antibiotic tablets or cream. Taking a swab at home. You may be given a swab kit by the clinic to take a sample yourself, or you can also buy home self-testing kits. Step 1, before taking the sample, wash your hands thoroughly with soap and water. Step 2, remove the swab from the packaging, ensuring that you do not touch the cotton tip. Hold the other end with your thumb and forefinger. Step 3, you can sit or stand to take the swab. Put the tip of the swab stick about 3/4 inch or 2 centimeters inside the vagina, approximately where you insert a tampon. Step 4, rotate the swab for 15 to 30 seconds. Step 5, place the swab into its container. You will need to label and date the sample before sending it off. Step 6, wash your hands with soap and water. Self-help measures. Screening tests get smeared annually or less frequently if suggested by healthcare provider. Vaccination. Consider having the HPV vaccine if you are offered it by your doctor. Discuss having the hepatitis B vaccine with your doctor if you change your sexual partner frequently. Safer sex. Use condoms and dental dams and visit a sexual health clinic immediately if you think you may have contracted HIV or hepatitis B. Thank you for your attention.